pass you straight over to Steve. Thank you.
Thanks so much. Good evening, everybody. Thanks for sparing your time to this. I'm going to do a Q&A after each talk, so do feel free to ask any questions. I'll be as clear as possible. So, as you'll appreciate, a bit of history. Prior to COVID, we had a very tried and tested exam portfolio. We had robust data about how quality assured the exam was. And then all of a sudden, and one of the key parts of this was having a whole bunch of patients turning up on the day of the exam to be examined de novo. And this would involve anywhere between 70 and 100 patients. I know from my own experience, standing at Southmead at 7 a.m. on a Sunday morning, it's quite an exposed position where, you could just get a couple of people turning up and everybody else thinking it's Sunday, I won't bother. So it can be a bit stressful for the host, but actually it's a great experience for examiners and candidates. So COVID arrived. Clearly, the first diet through COVID in May of 2020 was cancelled. If you remember, we were in the mire of everything just going chaotic in the hospitals. And then it became apparent that there was increasingly the risk of a backlog of candidates who were being delayed in their progression towards consultancy. And there was also this need for the NHS to have consultants on the ground to do the work clearing the inevitable backlog for all specialties, particularly in orthopaedics. So John McGregor and Martin Owen, who are secretariat lead and chair of the overall exam committee, sat down with us all, and we put a plan together to bring the exam to fruition in November of last year, where we went to Glasgow. We had a large hotel and conference centre to ourselves, and we put together an exam which had the same number of scoring episodes and the same, we hoped, robustness. And actually that has been proven to be correct with looking at the results that we gained from that experience. And we have, as you may well know, we have a further diet this coming weekend, and we've got an extra diet to replace the February which we lost in beginning of June of this year. So we will have the 3 diets this year in total, with November later on. So a very short presentation just to do the before and after. So then and now. So prior to COVID, so Sunday, the examiners all turn up on a Saturday evening. We do what's called standard setting, where we go through the questions in groups of, so the adult ortho viva, for example, will sit together. They'll go through all the questions which are going to be asked, and they'll standard set, i.e. decide what candidates need to say, perform, what the information they need to deliver is to get a 6, a pass mark, and then they'll go on and decide what constitutes a 7 and 8 or a 4 or a 5. And it's really important that we do that, because, as I say to all candidates, and you'll hear me, if you've not done the exam yet, you'll hear me say this in the briefing, if you get a 4 or a 5, you must not let it prey on your mind, because it is recoverable. There's no such thing as a kill station. There's no such thing as you get a bunch of 4s, you fail no matter what. That does not exist. Absolutely does not exist. You can have an absolute nightmare on one question, get 4s, and you can make it up. So it's important that we differentiate between 4s and 5s, and we differentiate between 7 and 8s, because getting an 8 may well make the difference between a pass and a fail if you've gone down somewhere else. My own Viva many years ago in adult pathology was a series of histology slides, and it was a complete nightmare and a disaster. But I made it up elsewhere, and that is the case, I promise you. So the old format, Sunday, it will be clinicals, and the reason for that is we're hospital based. Prior to COVID, the hospital clinic rooms or wards were quiet or empty on a Sunday, and we had the run of the facility. Plus, patients are not at work, etc. They're available to come in. So we do the clinicals, and then we do 1.5 days of oral exams, Monday and Tuesday morning. And the format was 2 intermediate clinical exams on the Sunday of 15 minutes each, and then 2 short case exams, each of which was 3 5-minute cases. The orals were half an hour each, and there were 4 of them. So that was the old design. So we can't use hospitals now because of the whole COVID thing. hospitals with COVID patients. We couldn't have a bunch of 150, 200 people descending on a unit where they've got COVID patients, and all sorts of infection protection mechanisms in place. There's a dearth of beds, etc. It's just not practical or sensible, and just looks bad. So we're having to use non-hospital facilities, and we've been using the conference centre and the big hotel in Glasgow. So this is what it looks like now. So one of the problems before was, if you had your Viva on a Tuesday morning, you had your clinical on a Sunday, you're hanging around for the whole of Monday. Previously a bit inconvenient, but not a terrible thing. Nowadays, of course, we don't want people congregating together. We want people in and out as quick as possible to get them back home, with regards to social distancing, not mixing, etc. So we've taken the opportunity to follow the general surgeons who do this model, where we have an oral examination on the Sunday. Those candidates will then do their clinical on Monday morning. We'll get a whole bunch of new candidates in at lunchtime Monday. They'll do their clinicals and they'll have their orals on the Tuesday. So people stay maximum of one night in the centre. They may want to come down the Saturday night for the Sunday, of course, and maybe 2 nights. But generally, there's a really quick turnover. You're away from home for a minimal amount of time. Doesn't matter about the hospital facility because we're not using it. We're using a hotel. So the other changes, of course, are with the clinicals. We're not allowed patients at the moment. You can't have. Just imagine the fallout if a bunch of patients got ill from COVID, having come to the examination, or a bunch of candidates or examiners because of COVID, because a patient came in with a snuffle on an undiagnosed COVID. So we were minimising personnel, and we still are at the moment. The clinical is virtual clinical. Now, we've been very, very clear with question writers that these need to be different from oral examination questions. And so the clinicals will involve clinical pictures of patients with pathological conditions or video clips. So rather than having a patient in front of you, you will have clear pictorial or video information, and then the Viva will go as per the normal clinical. There will be a history session, an examination session, and a decision-making management session, around about 5 minutes for each. Now, clearly the history, it will be a case of what would you ask the patient? What kind of details would you ask of the patient? How would you ask the patient about their pain, function, etc., rather than actually asking the patient. We have trialled the one examiner role-playing. That came back with relatively poor feedback. The candidates felt on some occasions that they were unclear as to when the examiner was a patient and when they were an examiner. So we're going to suggest to examiners that you know, I would say X to a patient. I would ask the patient Y. So the patient tells you that, etc. The demarcation is very clear. Examination will be, what will you look for? Tell me how you would approach examination of the knee, etc. You may be asked to demonstrate on a virtual model, etc. Not an actual model, just in space. Where would you put your hands to examine X, Y, and Z? And then the management question is clearly the same either way. Short cases, once again, clinical pictures or videos, and it'll be what do you see here? What's the cause of, etc. No history as such. It'll be a spot diagnosis and then a discussion about the causes and treatments of. So that's a little bit easier to do virtually. And there will be COVID precautions, of course. So we don't have lots of assessors hanging around. There's one assessor for the whole exam. We don't have training examiners sitting at your tables for the time being. It will return, but at the moment we're trying to minimise personnel gathering together, so there will be no extra person sitting at your table. There will be you and 2 examiners, and that's it. We all wear masks. We all get temperature checked, examiners, candidates alike. And actually it worked really well in November of last year. The candidates were very positive about the experience. So it's not entirely dissimilar. The marking scheme is exactly the same as it always was. So just the final slide. What has not changed? So the assessment, the educational assessment value and validity is unchanged. We know that. We have a KR assessment from all our examinations. The KR assessment for this was indistinguishable from real patient examinations. It's very educationally tight. and highly quality assured. We have a whole panel of educational psychologists who look at all the data from all the exams, and there is an incredible amount of data that they sift through to make sure that we're producing a quality assured, valid exam. If you deserve to pass, you should pass. If you haven't done enough to pass, then you will probably be asked to come back. That's what we aim for. You know, if you've done the work and you have the knowledge, the ideal is that you get through. All the questions remain standard set by the examiner panel. The adult Orth Viva examiners will sit together and decide together what constitutes a pass. So it should not be that if you go to one table and you perform X, if somebody else performs X at another table, we do not want them having a different result. The same performance should result in the same result, regardless of the examiner pair who you're seen by. So that's the importance of standard setting, and every question, clinical or oral exam, will be standard set, as always occurs. The scoring system, the descriptors for the examiners are unchanged. There are 96 marking episodes for every candidate in every exam, and you will be seen by 8 pairs of examiners. So 16 different examiners will see you. Now, occasionally it's 15, because if we have a candidate who's known to an examiner, we switch them. It's possible you may be seen by one examiner twice, but if that's the case, they will always be paired up with a different examiner. You will never see the same examiner pair. So most candidates will have 16 different assessments, and the examiners do not discuss afterwards how you did and come to a conclusion. They occasionally ask each other about, did X say Y or Z? I can't remember. Just remind me, did they discuss Y? Factual correction or factual confirmation is asked, not an opinion as to the score. So you are independently marked by 16 different examiners. And if you get 576 marks, which is an average of 6 for each question, then you will pass. And if everybody in the room gets 576, you will all pass. This is not you against your colleagues, it's you against the exam. And we can pass everybody if everybody gets the marks required. And to be quite honest, it's inevitably an anxiety-inducing hurdle in your life. It's a high-stakes exam. People have worked for it for a long, long time. Of course, you're going to be anxious, but rest assured, the examiners will do as much as they can to get you through. They're very professional, and they have to be robust because this is about patient safety. But they do not try and catch you out. They do not go out of their way to be difficult. They do not make stupid remarks to people. They're very professional about this. They give up their time over a weekend and the beginning of a week for nothing. They don't get paid for it, and they wouldn't do that if they weren't interested and genuinely educationally minded. So they will do their best to offer you the opportunity to deliver the information that you have. I can guarantee you of that. And we assess examiners all the way through. We train them properly to do this. They're not just brought in and say, "Oh, sit there and ask a few questions." It's a formal professional process. So going forwards, Glasgow is going to be used this coming weekend and again at the beginning of June. It may well be a different venue next November. It's a bit unclear at the moment. We're still trying to work out where to hold it. It will not be a hospital venue. I don't think hospital venues will be used again, to be quite honest. I think it'll be a conference or hotel facility. It will go back to rotating, more than likely. Certainly I can tell you, given that winter's coming at the end of this year, as it always does every year, we don't know what's going to happen in winter with regards to COVID, flu, etc. Will there be a fourth wave? Given the anxiety and given the fact we do not want to change and then change all over again, we've got GMC approval, the 4 college president approval, to continue with this model of virtual clinicals, oral exams as normal, non-hospital facilities until and including the February 2022 diet. After that, we hope to be able to return to using patients. And that's, other than urology who've never used patients, that's the feeling of most exam boards. We would like to go back to using patients because it gives more of a real life experience for the candidates and the examiners. There will be different, I think there will be fewer patients for social distancing, given that this could happen again, and to be able to use the facilities, non-clinical facilities, but there will be a return to patients at some point. But for the next 4 diets, so this weekend, June, November, February 22, it will be this model with virtual clinical assessments. That's about it, I think. I'm more than happy to clarify the new model or anything people have got to ask about the examination in general. Just ask.
Thanks, Steve. That was very comprehensive, and I think it addressed a lot of anxieties I had back 10 years ago about it's nice to hear if you meet the pass mark, you're fine. You'll
Absolutely.
pass.
Absolutely.
There's a couple of questions that come in that were quite logistical questions, which are just asking when will we receive a confirmation for sitting in June, the June diet?
Sure, as soon as possible after this coming weekend, I would say.
Okay, thank you. And someone else asking, when are we notified which day the oral exam will be?
Well, hopefully you'll know if you're doing this coming diet. And they send you a thing out around about 2 or 3 weeks before with regards to what day you're expected.
Okay, thank you. Nicole Corrin says, will it be suits or bare below the elbows? There are no patients.
So no patients. So the advice is standard business tire. So you don't need to be bare below the elbow. You can wear a tie if you're Jen, or you can you don't need to roll your sleeves up. You can wear a watch. Worth mentioning, and I will say this in the briefing prior to every examination, if please have a bag or something or somewhere. We do give you a secure room for the candidates. We ask you to leave your phone in there, simply because it's you can't have people recording the examination, and we can't take the risk that they record the examination. The reason for that is we do not want the exams questions being shared, because if somebody passes because they've heard the question rather than because they have the knowledge, once again it comes back to being a patient safety issue. And you know, the GMC are very clear about this, and they have asked to hear about people trying to cheat the system, so they are really conscious of this. This is about passing an examination to allow you independent practice, and it's clearly a patient safety issue, and because of that we have to be incredibly robust about the fairness of the exam. You need to pass because you know it, not because you know what the questions are. In fact, you know what the questions are. The syllabus is out there, it's written down, it's online.
One last question. People often, basic science, people draw pictures to explain a whole variety of things. Is that still going on?
Absolutely, yeah. Now, occasionally there will be we do have some virtual exams where people in Ireland at the moment who can't travel over here. We've done some virtual video examinations, so they will have paper at their end. They can demonstrate and draw a diagram. The video, as I'm sure everybody is aware on this call, the video conferencing facilities are great these days. We make sure we have a good, robust internet connection. And so yeah, drawing on paper. There's still paper, there's still pencils. You will still be sat across a table from an examiner's, and you'll be wearing a mask, but there's nothing to stop you drawing pictures.
Perfect. Thank you very much, Steve. That's really great.